So the sphingosine-1-phosphate receptor modulators are in use now for treating MS. The first one was fingolimod, which was approved in 2010, and we've been using it ever since. More recently, an S1P1, so a more selective sphingosine-1-phosphate receptor modulator, was approved, and that was tested in secondary progressive MS. It was approved for essentially relapsing forms of MS, despite what it was tested in. And the agents themselves do a good job of controlling lymphocyte trafficking, and they do that by keeping lymphocytes in the lymphatic system, in the lymph nodes, and blocking their ability to get out of lymph nodes, and therefore they can't get into the bloodstream and then can't get into the central nervous system. The TRANSFORM study was done with fingolimod and comparing it to interferon beta-1a given intramuscularly once weekly. It was a one-year study, and the fingolimod was superior to the interferon in reducing relapse rate. There wasn't much change in disability metrics, but over 1 year, that's kind of hard to do. The Sunbeam study involved another S1P1 called ozanimod. And there it showed in a relapsing form of MS that it reduced relapses and reduced the MRI activity similarly. How we use the agents right now, the clearest use is in relapsing forms of MS. So that's clinically isolated syndrome, relapsing remitting MS, and any progressive patient who's also having relapses. Now the FDA has labeled that as secondary progressive with activity. Use in other secondary progressive patients is a little less clear, but that's what was tested when siponimod in what was called the EXPAND trial. They tested it in all secondary progressive patients, but the FDA didn't label them for that. And we need to do some more analysis and get a better understanding of the role, but there is a disconnect there between what was studied and what was actually approved. The safety concerns of S1P receptor agents involve around cardiac changes. One has to be careful in individuals who have any defects in cardiac conduction. At least with fingolimod, there's a first dose observation because you can get a bradycardia. That's not necessary in siponimod, but siponimod has different criteria in terms of some genetic testing for metabolic enzymes. You can get, in rare cases, macular edema, fluid behind the retina. Infections can occur. You have to watch liver function. You have to watch lymphocyte counts and be aware of the fact that you can get some opportunistic infections. They're not common, but you have to be aware that they can occur. The S1P receptors can be used in any relapsing form of MS. Their data support that. The safety, by and large, has been good. With the caveats that I discussed. There are some individuals where you don't want to use them, especially, again, as I said, those with cardiac issues, especially cardiac conduction issues, and so that requires some pre-screening. There also is the potential for rebound when they're stopped, and so one has to be careful about how one discontinues an S1P receptor modulator and plan on starting something else pretty quickly.